Well, good morning. I'm Dr. Brian Weinschenker, Professor of Neurology and a member of the Division of Multiple Sclerosis and Autoimmune Disorders at Mayo Clinic. I'm here to talk to you this morning about plasma exchange and its usefulness for multiple sclerosis. Plasma exchange is a procedure wherein blood is removed from a patient, usually through a line inserted into a vein, and is separated by a machine, by a centrifuge machine, into the liquid portion of the blood that contains antibodies and various proteins and the cells. The liquid portion of the blood is removed and is replaced with an artificial plasma and then mixed with the patient's own blood cells and returned to the patient. And the purpose of this procedure is to remove that liquid portion of the blood, or the plasma, which it's usually used for autoimmune diseases of various types. And in autoimmune diseases, there may be portions in the liquid, or proteins in the liquid portion of the blood, typically antibodies that may be producing disease. We became interested in this procedure for multiple sclerosis in the early 1990s. Dr. Moses Rodriguez had studied 6 patients, or treated 6 patients with plasma exchange in what we call an open label study. And these were patients with very severe attacks of multiple sclerosis, typically with paralysis, and they had received the standard treatment of intravenous steroids and had not recovered. And after treatment with 5 to 7 courses of plasma exchange, the patients experienced dramatic recovery. There had been others who had tried plasma exchange in multiple sclerosis with mixed results, but we had felt that no study had been done to look at this subgroup of patients who had very severe attacks and had failed standard treatment. So we put together a controlled clinical study that was sponsored by the National Institutes of Health and conducted over 5 years at Mayo Clinic, and involved 22 patients of this type with very severe attacks of multiple sclerosis. And we were able to confirm these results. And as a result, we now recommend the use of plasma exchange in exactly this situation. Patients with MS or related diseases like neuromyelitis optica or acute disseminated encephalomyelitis, who have very severe attacks and severe neurologic deficits, who receive standard treatment with intravenous steroid treatment, which is usually helpful, but when it does not help, we find that plasma exchange, 5 to 7 procedures, often results in dramatic recovery. About 50% of patients seem to benefit. Patients that have pathological antibodies, or antibodies that cause disease in their blood, and we know, at least in the case of neuromyelitis optica, we've discovered such a pathologic antibody that reacts with a protein called aquaporin 4. These patients seem to have particularly good and robust responses to plasma exchange. So this is a procedure that we do not do often. It is an expensive procedure, but it is relatively safe. But it's usually given once only in the context of an acute attack and not as a continuing treatment, and is quite effective. At Mayo, we have a Department of Transfusion Medicine that does these apheresis procedures. The procedures can be done very efficiently. They don't require hospital admission. Many patients are able to be treated on an outpatient basis. In fact, the only reason to be in hospital is if the neurologic deficit makes it impossible for the patient to manage as an outpatient. But we've used this just last week in a patient who had blindness of both eyes due to an attack of neuromyelitis optica, and it was all done on an outpatient basis. It's a very safe procedure overall, very few serious side effects. Many patients will require a central line put into the jugular vein in the neck, which will stay in place during the period that the patient's receiving treatment, and then they get hooked up to the plasma exchange machine just for the procedures. There is some risk to the insertion of this line, but our interventional radiology department does this for us, and we have a very low rate of infection or other serious complications with the line insertion.